Coronary artery disease, CAD. Coronary artery disease is a common heart condition. The major blood vessels that supply the heart, coronary arteries, struggle to send enough blood, oxygen and nutrients to the heart muscle. Cholesterol deposits, plaques, in the heart arteries and inflammation are usually the cause of coronary artery disease. Signs and symptoms of coronary artery disease occur when the heart doesn't get enough oxygen-rich blood. If you have coronary artery disease, reduced blood flow to the heart can cause chest pain, angina, and shortness of breath. A complete blockage of blood flow can cause a heart attack. Symptoms may go unnoticed until a significant blockage causes problems or a heart attack occurs. Following a heart-healthy lifestyle can help prevent coronary artery disease. In this video, we'll cover the basics of coronary artery disease. Coronary artery disease, also called CAD, is a condition that affects your heart. This can cause chest pain, shortness of breath or even a heart attack. But there are ways to prevent coronary artery disease, and ways to know if you're at risk and ways to treat it. However, too much buildup can lead to a blockage, obstructing blood flow. There are a number of risk factors, common red flags, that can contribute to this and ultimately lead to coronary artery disease. High blood pressure can thicken your arteries, narrowing your blood flow. High cholesterol levels can increase the rate of plaque buildup. If a close relative was diagnosed at an early age with heart disease, you're at a greater risk. All these factors together can paint a picture of your risk for developing CAD. When coronary arteries become narrow, the heart doesn't get enough oxygen-rich blood. And you may begin to notice these signs and symptoms of pressure or tightness in your chest. When your heart can't pump enough blood to meet your body's needs, you might develop shortness of breath or extreme fatigue during activities. And if an artery becomes totally blocked, it leads to a heart attack. Classic signs and symptoms of a heart attack include crushing, substernal chest pain, pain in your shoulders or arms, shortness of breath, and sweating. However, many heart attacks have minimal or no symptoms and are found later during routine testing. They'll be able to look at your medical history, do a physical exam and order routine blood work. Treating coronary artery disease usually means making changes to your lifestyle. Reducing cholesterol, lowering blood pressure, quitting tobacco, eating healthier, exercising and managing your stress can make a world of difference. Symptoms may go unrecognized at first, or they may only occur when the heart is beating hard like during exercise. As the coronary arteries continue to narrow, less and less blood gets to the heart and symptoms can become more severe or frequent. Smoking or having high blood pressure, high cholesterol, diabetes, obesity or a strong family history of heart disease makes you more likely to get coronary artery disease. If you're at high risk of coronary artery disease, talk to your healthcare provider. You may need tests to check for narrowed arteries and coronary artery disease. If there's too much cholesterol in the blood, the cholesterol and other substances may form deposits, plaques, that collect on artery walls. If there's too much cholesterol in the blood, the cholesterol and other substances may form deposits, plaques, that collect on artery walls. Plaques can cause an artery to become narrowed or blocked. Plaques and blood clots can reduce blood flow through an artery. Coronary artery disease starts when fats, cholesterols and other substances collect on the inner walls of the heart arteries. Plaque can cause the arteries to narrow, blocking blood flow. The plaque can also burst, leading to a blood clot. Besides high cholesterol, damage to the coronary arteries may be caused by age, genetics, other health conditions and lifestyle choices can affect the health of the heart arteries. When grouped together, certain risk factors make you even more likely to develop coronary artery disease. For example, metabolic syndrome, a cluster of conditions that includes high blood pressure, high blood sugar, excess body fat around the waist and high triglyceride levels, increases the risk of coronary artery disease. Sometimes coronary artery disease develops without any classic risk factors. The same lifestyle habits used to help treat coronary artery disease can also help prevent it. A healthy lifestyle can help keep the arteries strong and clear of plaque.